Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thanks for joining. Today we will discuss evaluating a patient's health before dental surgery. It is important even though it might seem boring because there are no pictures, just text in this video. Pay attention because understanding a patient's medical history and doing a physical examination is crucial for safe dental care. We will cover how to do these and use the ASA classification system to assess patient risk. So let's move on. Preoperative evaluations vary based on the type of anesthesia and the complexity of the dental procedure. Typically, a primary care physician does the comprehensive history and physical examination. Dental professionals must identify medical issues to ensure safe care, especially for patients undergoing dentoalveolar surgery, which involves more stress, potential bleeding, and the need for pain and anxiety control. So let's start with the first and most important aspect, that is the medical history. A thorough medical history is vital to determine if a patient can safely undergo dental therapy. This reduces the need for physical examinations and lab tests. This box outlines the standard format for recording medical histories and physical examinations. It includes different components as shown in this table. Start by collecting the patient's basic information and an impression of their reliability, which continues throughout the interview and clinical examination. Every patient should state their main issue, which helps set priorities for treatment. Patient should describe the history of their complaint, including its onset, changes, and pain characteristic. Use medical history forms to collect initial health information. Ensure the forms are clear, concise, and confidential. Flag important responses for the dentist attention. This box lists the baseline health history, includes past medical events, recent illnesses, medications, health habits, and the last medical checkup. Okay, move on forward. Inquire about medical conditions that could affect dental management, like heart issues, bleeding disorders, lung disease, and diabetes, which could affect dental management. Also ask about allergies and confirm pregnancy status for female patient. Family medical history should focus on inherited diseases like hemophilia. Update it regularly and ask about health changes during checkups. This box lists common health conditions that should be inquired about. It is important to note that the review of systems involves asking patient about their symptoms related to different body systems to identify potential health issues. In contrast, clinical examination of the systems involves physically examining the patient to assess and diagnose their health conditions directly. So the review of systems methodically checks patient symptoms across different organs and may reveal undiagnosed conditions. Adjust it based on the patient's history and planned procedure. The review includes symptoms in the head and neck and maxillofacial regions such as pain and functional limitations. Check for specific symptoms in the cardiovascular and respiratory systems like chest discomfort and shortness of breath. The physical examination for dental patients focuses on the oral and maxillofacial areas, starting with vital signs and using inspection, palpation, percussion, and auscultation. The steps for a physical examination include inspecting the head and face, palpating the temporomandibular joint, percussing the mouth, and auscultating the joint and neck. A dentist should do a brief maxillofacial examination during patient interviews, checking head shape, eye movement, hearing, speech, and breathing. A detailed maxillofacial examination covers the temporomandibular joint, nose, paranasal region, mouth, and neck, identifying issues that might affect dental treatment. The American Society of Anesthesiologists classification system assigns a physical status to a patient based on their health. For ASA and healthy ASA2 patient, routine treatment with anxiety reduction measures is usually enough. For more complex cases, ASA 3 and above. Options include modifying the treatment plan, seeking medical advice, refusing treatment in an office setting, or referring to an oral maxillofacial surgeon. In conclusion, thorough preoperative evaluations, including medical history, review of systems, and physical examinations, are essential for safe dental care. Dentists need to be skilled in maxillofacial examination and using the ASA classification to ensure the best treatment outcomes and patient safety. Thank you. Wish you best of luck.